Right, good afternoon. It's Dr. Roger Mochigemba and Shankar Ponsley myself. And as you know by now, whenever we go live, we talk about Dr. Mochigemba's passion to improve access to healthcare, not
Affordable
only for
access.
what is
Affordable
that?
access. Affordable access.
Affordable, yeah, very important,
Yeah.
affordable. Uh, and that's not only for individuals that you do that for, but also for employers, right?
Right. And so it's kind of both because employers pay for the majority of healthcare in this country.
Yeah, that is a very important insight. And I know that you have really started out building a network of employers here in the San Antonio area. But the question I have is, with employers that are larger and knowing that there are still relatively few DPCs around, how can you help like that? How can you overcome that limitation?
That's a great question, Shankar. And actually, that's a really important one for a lot of companies that are larger because they have they have people all over town if it's a big town like San Antonio, or they have people in other parts of the state or out of state. So um, here's how we can do that. So as direct primary care has been evolving, we have the ability now to develop affiliates in other parts of the city or the state or the country. And that's a beautiful thing. So I can actually talk about something that we're doing right now with an employer that's got a couple of hundred people in San Antonio. And then they also have a company that they acquired in Oklahoma that has a couple hundred people or thereabouts. So they're interested in DPC. Their home base is in San Antonio, so their home base can use us pretty easily, and it makes sense to do that.
Mm.
But if but how do they provide DPC for the folks in Oklahoma? Well, I reached out to a DPC clinic in Oklahoma that is near their facility up there and established that DPC clinic as one of my affiliates. So when the company uh, pays directly to Direct Med Clinic for this health care, they only pay one clinic and they get the same DPC benefit. And then in the back end, Direct Med Clinic handles the distribution of that, the rest of that to the Oklahoma clinic. So
Wow.
So we can do that. And then we can also have affiliates in that aren't even DPC. We get a question frequently from employers like, well, how many clinics do you have, Dr. Roger? Well, we have our main clinic, but we also have the ability to develop other affiliates that don't even have to be DPC.
Mhm.
I'd love to try that with a company that is looking for something like that.
And does that also go for maybe specialists or like say imaging?
Well, imaging's a little bit different.
Mhm.
We have um, our ways to have we have cash pricing for imaging here in San Antonio. The affiliate does as well. So if I had a couple of more affiliates in the San Antonio area, as long as that imaging order is coming through us, then we'd be able to provide that same cash pricing for imaging, and the same would hold true for lab as well.
Mm. Well, you know what I find really inspiring and impressive, I must say, is that it clearly shows that as DPC doctors, not the profit is at the forefront, because if individual DPCs are willing to collaborate and work together to provide more affordable and accessible and better healthcare, then that's really a beautiful thing, and that is really a testament to a different mindset, right?
Yeah, it is so much fun to work with doctors like this, because we all uh, like this model, and it's fun to practice medicine this way.
Yeah.
Yeah.
Okay, so tell us, our audience, they can see this ticker that has the website link.directmedclinic.com/employers, and
Mhm.
tell us what that is about.
Yeah, I'd love to. So on May 3rd at 10:30, we're going to do a live webinar on LinkedIn, and I'm going to talk about the basic concepts and that we have in place in the DPC model that allowed me to save this one employer client of ours almost $1 million. Okay, so that's what we'll be talking about. So I hope everybody makes a note of that. Actually, don't make a note; just go and register because you have
Yeah,
to RSVP to get into this one. So
absolutely. It's not
looking
going to be a
forward to that.
public link. Yeah, you need to have the Zoom link, and you get it by registration.
Yeah, so the word is getting out about DPC and how it works for employers. I heard a broker friend of mine, we were talking, and he said his company did a company-wide webinar about DPC, so all of their brokers would know about it
Mhm.
because it's a up and coming thing.
Yeah, it's definitely up and coming. And what I know is that, whenever there's a trend, you have a lot of people who just hop on and want to benefit from it. But with you, that is really, truly different because this is something that you have been pursuing for years and years. So the experience that flows in what you do for employers is really hard to beat. And I know that for a fact.
Well, thank you. And I I'm not. I knew it's just a matter of time before the word started to get out, and that's why I appreciate your good help because ever since we've been working together, that's been our underlying theme is to show people the great value of DPC and let them know that this it really is a thing. Direct care is health care. This is restoring the fundamental tenet of healthcare. It's the doctor-patient relationship, and it's also uh, company to clinic, that relationship.
Right.
And so, because of that, direct care and that relationship allows this model to save companies lots of money, and that's what we're going to talk about on May 3rd at 10:30. So, I hope everybody will join in for that.
Yep, let's repeat the link one last time. It's link.directmedclinic.com/employers. We'll also put it in the comments section here around this video. And I think it is safe to say that we can wish our viewers a great weekend ahead, and we'll probably see each other again next week.
Sounds good.
Right.
Have a great weekend, everybody, and Shankar.
Thank you. Bye bye.
Bye.